So what you have here are the contents of the bandage kits that we send home in our equine bandage kit. So the first thing you'll have is your non-stick dressing. You also will get a pack of gauze sponges, a small roll of gauze, a sheet cotton, a brown gauze, a vet wrap, and an elasticon. So when you go to apply your bandage, you want to try to avoid touching the bandage material as much as you can, so opening it cleanly. The first areas or layers of the bandage that you'll need will be your non-stick bandage that'll go directly against the wound or the sutures, the 4x4s to go behind that, and the roll gauze. So using just a corner, you can lift the sterile gauze and place it on your gauze pad, but again, try not to touch the middle where it's going to be against the horse's skin. This can then be taken gently out of the tray by the corner again to avoid touching the center. So for a distal limb bandage, for example, after a splint bone surgery or if your horse has a wound on their cannon bone, we'll start with the non-stick gauze or adaptic, followed by a stack of sterile 4x4s, and this will be held on with your cling gauze. This should be wrapped over the leg snugly enough to hold the gauze in place, but not very tightly. And this can be taken a little above and a little below the wound to just secure this gauze in place. When you reach the end of your roll, you can tuck the end in order to hold it in place while you get ready for the next layer of your bandage. So once your roll gauze part is on, the next step will be the sheet cotton. This will come in this blue outer casing to keep the sheet cotton sterile. As you open it again, you want to not touch it excessively, although it's okay to touch it to some extent as you're going. So the sheet cotton will be held in place with the brown gauze. That comes in this paper tube. You can pull that out, and then you'll take your sheet cotton to apply to the limb. The next layer of your bandage is going to be the sheet cotton. This should be placed with your wound centered under it. In the same area you would put a standing wrap. And this should be wrapped with nice even pressure and fairly snugly around the horse's limb. The sheet cotton is held in place with the brown gauze. The brown gauze should be placed in with firm pressure and with about 50% overlap between each layer. Make sure to leave a small portion of the sheet cotton from the top and the bottom of the limb. Again, once you've reached the bottom, you again want to have that little piece of sheet cotton sticking out with no brown gauze contacting the skin. Once you've reached the bottom, just work your way back up, again with 50% overlap with each layer. And as always, make sure you're wrapping in the same direction with each layer of your wrap. Again, with this, you can tuck the tail in to hold it in place while you get ready to apply your next layer. If your horse is sent home with a stack wrap, you'll apply your distal limb wrap first, and then place a sheet cotton over the more proximal or upper portion of the limb. With this sheet cotton, you want to overlap your more distal or lower one by about 1 inch, and you want to apply your sheet cotton with even pressure. This is again overlaid with a brown gauze with a small amount of sheet cotton remaining out of the top of the bandage. And the brown gauze should be applied with firm, even pressure, putting pressure against the front of the limb and about 50% overlap with each layer. With this brown gauze, it can be carried all the way down to the bottom of the sheet cotton and a little past it in order to really combine the top and bottom portions of the bandage. Once you've gotten down past that layer, you want to work your way back up. The tail of your gauze can again be tucked in order to hold it in place while you get ready to apply your next layer. The next layer of your stack wrap will be your vet wrap. And this can be applied directly over your brown gauze. I typically start at the bottom and work my way up. With your vet wrap, you want to stretch it so some of the inherent wrinkliness is gone and about 50% overlap with each layer and nice even pressure. Once your vet wrap layer is on, your next layer will be your elasticon. This is an elastic adhesive bandage that we want to apply with relative looseness. Approximately 50% will go onto your bandage and the other 50% on the horse's leg. You want to take this around once or twice and again apply it relatively loosely, so once you've stretched it, allow it to snap back before applying it. And this should be repeated at the bottom of the bandage. And the elasticon just helps to prevent dirt or debris from getting into your bandage and helps keep bandages from sliding up or down. Again, apply about 50% of the elasticon to their foot or to their skin and 50% to the bandage. Okay. When placing a stack wrap, your bandage will go over the horse's natural bony protuberances like their accessory carpal bone or in the hind, the point of their hock. It's important that we make a small cut in the bandage in order to relieve any tension that we've placed over these areas as they're more prone to bandage sores. With this, we can use a scalpel blade or a pair of scissors to make a small cut in the bandage that goes through both the vet wrap and the brown gauze so you can see your white bandage material underneath. Once you've made this cut, this area should be overlaid with a small piece of elasticon in order to keep any debris from working its way into the bandage. Once applied, your stack wrap is complete.